There is no shortage of churches in Mississippi. I tell you, it's a church pretty much about 2 or 3 on every corner.
Alzheimer's and dementia is in our community. We've all been touched by this treacherous disease, whether it be from a family member or a friend. However, thankfully, here at our church, we have this ministry and we have the support so you can know that you are not alone.
Good afternoon, everyone. That's what I like. Thank you all for joining us today for our Alter Dementia workshop. The churches are a part of the community, and from the state level, that's what we want to go into the community.
Alter Dementia is a program where we are supporting Black faith communities across the country with the resources that they need so they can better support their parishioners and the community that they serve.
Let's talk a little bit about dementia. So remember, it is an umbrella term. There are many different types or forms of dementia.
People don't want to come to the health department because it's a stigma, but we have a new way of doing things.
With BOLD, we've been able to leverage this ecosystem approach. And so now the public health model is connecting the resources with these community clinical linkages. It's increasing that risk reduction awareness.
We at Mississippi State Department of Health, we have the resources, the data, and the expertise to get all this information to our health ministries.
Y'all, this one hits the Black community, vascular dementia.
We teach, we model, and we train people to be healthy. We do nutrition, we do educational information, particularly about diseases that are sort of rampant in our community: hypertension, heart disease, and dementia.
What's another prevalent one in our community that I'm leaving out? Diabetes, that's it.
As a wellness ministry, our purpose is health, mind, body, and soul.
I want to just remind y'all, love never gives up, never loses faith, and is always hopeful and endures through every circumstance.
Mississippi, regardless of our mortality rate, regardless of our morbidity rate, we understand and we know how to connect caregivers and individuals living with dementia to the right partners and the right friends so they can get absolutely the best care they need for their loved ones who are living with dementia.
Since 2005, the Healthy Brain Initiative has been led by a partnership between the Alzheimer's Association and the Centers for Disease Control and Prevention. Through this partnership, the association and the CDC developed the Healthy Brain Initiative Road Map to guide public health progress. There are 43 BOLD program awards given to state, local, territorial, and tribal public health departments to implement interventions to deliver health at the community level. A public health approach brings the promise of risk reduction, early detection, awareness-building activities, treatment, and care to every community, and there is a significant need to ensure that work continues.